this video, let us start about abortion. So what is abortion? A pregnant female who complains with bleeding, especially in the first trimester. So first trimester or second trimester, if the female is having, especially pregnant female is having bleeding, then you can say it's a sign of abortion. Okay, so the differential diagnosis are like, so either a female comes to you in first trimester or second trimester with bleeding, then the chances may be either abortion or ectopic pregnancy or molar pregnancy. So this is thing which you need to observe. Okay, so pregnant female for second trimester with bleeding, maybe abortion, ectopic pregnancy, molar pregnancy. So first let us start what is called as abortion. So any pregnant female loss that occurs at any pregnancy loss which occurs less than or equal to 20 weeks is called as abortion. So according to WHO, any pregnancy loss which occurs when the weight of fetus is less than 500 grams is called as abortion. So the weight of fetus is less than 500 grams and there's loss of pregnancy less than 20 weeks. Okay, so according to ultrasound definition for abortion is the mean sac diameter. The mean sac diameter is greater than or equal to 25 millimeters and there is no cardiac activity and or cannot see a fetal pole or cannot measure the crown rump length. Crown rump length is also absent and cardiac activity is also absent. This is called as blighted ovum. Blighted ovum or an embryonic pregnancy. So about this already blighted ovum we discussed in the first video itself. So now coming to crown rump length. If the crown rump length is greater than or equal to 7 millimeters and still there is no cardiac activity, right, then this is called missed abortion. Okay. So now coming to repeated abortions. Some females may have repeated abortions like 3 or more. Okay, so this is called as repeated abortion. Now coming to isolated abortion. Isolated abortion can be in the first trimester or in the second trimester. The most common cause of isolated abortion is chromosomal defect. Chromosomal defect, especially in the fetus, there is chromosomal defect, or you can say germ plasm defect. Okay, so most common chromosomal anomaly is aneuploidy. So as we said, the most common cause of isolated abortion is chromosomal defect in fetus, and that too the main one is aneuploidy. It is a defect in chromosome number. Defect in chromosome number. Okay, so the second best answer, like if you ask in isolated abortion what is the most common, then you will say chromosomal abortion, chromosomal defect. The second reason is trisomy. The third reason is monosomy X, which is seen like about in 20% people, and the fourth reason is trisomy 16. So according to the best answer we need to answer this. Okay, in isolated abortions the most common reason is chromosomal defect, that too aneuploidy. Okay, and the second one is trisomy, next one is monosomy X, that is seen in 20%, and next trisomy 16. Okay, and note that infections can also lead to single episode of abortions. So this isolated abortions not only because of this defects also add infections here. Okay, like most common time of abortion is in the first trimester greater than second trimester. So whenever you say abortion, always you expect this in first trimester. The second most common risk for abortion is increased maternal age, mom is very big, or previous history of abortions. So these are the causes. Okay, so previous history has like about 20% risk. 2 previous abortions, then you will have 30% risk. If 3 previous, 40% risk. So if the abortions are continuous, then they will continue like that only. Now coming to recurrent pregnancy loss. So recurrent pregnancy loss, in the name itself you can see it is recurrent. It is occurring many times, either 3 or more consecutive pregnancy loss, which is occurring less than or equal to 20 weeks of gestation. Okay, so investigation should be started even after 2 consecutive pregnancy loss. So investigation started at 2 losses. So now coming to most common cause of this recurrent is idiopathic. You don't know why, but the most common group causing this recurrent abortion is uterine abnormality. There's some uterine abnormalities, either they may be congenital or they may be acquired problems, like you can take cervical incompetence, okay, or uterine malformations, or any formation of fibroids in uterus. So all this may be the problems, okay. And the most common single cause leading to recurrent abortion, if they are single cause, then it would be APLA syndrome, that is antiphospholipid syndrome, antiphospholipid antibody syndrome, okay. And the second best answer would be cervical incompetence, and the third best answer would be hypothyroidism, okay. And hypothyroidism can be either clinical or subclinical, and both may be the causes of abortion. And the fourth best answer would be chromosomal defect, like balanced translocation of chromosome in either of parents. 4% of recurrent abortions are due to this. Only 4% chance of recurrent abortions due to this problem. So hyperthyroidism and infections like TORCH does not lead to recurrent pregnancy loss. This is a clear statement which you need to mind, that hyperthyroidism and infection like TORCH, they doesn't lead to any recurrent recurrent abortion loss. Now coming to syphilis. Syphilis is the only infection which can lead to recurrent, okay, pregnancy loss, where you will do VDRL test. Now coming to karyotyping. So karyotyping should be done for the both parents, should be checked for presence of any translocation. So for any translocation presence, we will do this karyotyping. Now coming to APLA, antiphospholipid antibodies. APLA antibodies. What are these? APLA antibodies are, the first antibody is lupus anticoagulant, which is the most common lupus anticoagulant. The second one is anticardiolipin antibody. So these are the different antibodies which are found, okay. And the third one is anti-beta 2 glycoprotein 1 antibody. So these are different antibodies which we need to remember. So presence of any one along with clinical criteria gives diagnosis of alpha. So either in these 3 antibodies at least one should be present, okay. Now coming to cervical incompetence. Actually cervical incompetence investigation is done by means of TVS. TVS also detects the fibroid and uterine malformations, okay. Uterine malformations, now let us see this. Uterine malformation, investigation of choice is 3D ultrasound, and the gold standard is MRI. Coming to hypothyroidism. Hypothyroidism, the TSH should be measured, and TORCH test should not be done at all. TORCH test is not at all related with this abortions, that you need to remember. Next, coming to the most common uterine malformation which is leading to recurrent abortions. So most common uterine malformation for recurrent abortions is septate uterus. Septate uterus, which we need to remember, okay. And next, coming to submucous fibroid. Submucous fibroid. is most common fibroid causing recurrent abortion. So this is the most common fibroid which is leading to recurrent abortion. So by this we completed the part 1. In the next part we'll discuss in detail of Epla syndrome, cervical incompetence, okay, and next cartilage, types of abortion, all this.